Well, thanks again for joining IEC for our Lunch and Learn series. Many of you have been on the last several weeks. We've been doing these for over a month now, and we hope these sessions continue to keep our community connected during a really difficult time. Definitely with this community, I've been really impressed by just how we've come together to support each other during this pandemic. So we hope that this series is educational and informative, and you learn a little bit about IEC's work and our partnerships. Since our founding in 1975 by a group of dedicated grassroots environmentalists, IEC has led issue advocacy campaigns by allowing environmental organizations to pool their resources and create a higher profile for environmental issues. Today, we represent over 90 different environmental groups from across the state and have nearly 400 individual members. If you're not already a member of IEC, you can support us and sign up. There will be some instructions in the chat box. Paloma from IEC is our tech support for the day. So if you have questions during this presentation, we will be doing a Q&A at the end, but feel free to drop in any questions as we go into the chat box. If you called in, you can hit *9 to use the raise your hand function. And again, we'll continue to do questions towards the end. So again, for those who jumped on a minute or two late, I'm Colleen Smith. I have the pleasure of serving as the Legislative Director at IEC. Usually right now, I'm in Springfield, running around anxiously about a lot of different bills, one of which we'll talk about today. Instead, we're all here in our homes doing what we need to be doing to protect our communities. The issue today is pharmaceuticals in our water and in our environment. You're going to hear from three really excellent experts, James Jennings with Illinois EPA, Representative Jennifer Gong-Gershowitz, and of course, MWRD Commissioner Deborah Shore. I'll let them introduce themselves as well as we dive in here, and hopefully this will be really informative, and thanks for joining us today. So with that, I'm gonna share my screen and we're gonna kick it over to James. And if you could just give a little bit of background again about who you are and then get us started. Thanks, James.
Thanks, Colleen. So I'm James Jennings. I manage IEPA's Waste Reduction and Compliance section, and our group is responsible for administering the state's materials management programs, which for the last 3 years has included a really robust statewide medication take-back program. And so I'm going to provide an overview of where we are right now and give a very high-level glance at how some of these models are applied in other states, where we get our funding from, and then where we're hoping to go once things resume whatever normal looks like at some point, hopefully, in the near future. So I go ahead to the next slide. All right, and so, and I know that this is going to be covered throughout, so I'm going to just go quickly through this, but I mean, there's a number of reasons why appropriately handling medications and sharps is important within your household. For a long time, the conventional wisdom was that it was appropriate to flush unused medications in with any other water source. The inherent problem with that is that impacts the water that we all drink and that we use for any other type of enjoyment. USGS did a study earlier this decade that identified that there were traces of medications found in drinking water and in recreational water sources in 30 states nationwide, one of which was in Illinois. Beyond that, there's an inherent public health risk. Items that you don't need in your home that can be inappropriately used sometimes are. And so as a result, there's a poisoning and overdose risk with certain medications. And then in addition to that, sharps are included in the agency's collection program, and beyond having concerns with needles in people's homes, waste haulers, people who work for recycling organizations, reporting an extraordinary number of inadvertent spits the last study that the Solid Waste Agencies of North America did on this identified that about 2.5% of recycling facility workers had reported being stuck with a needle that had been processed with other recyclables. And so I'm going to just put that into perspective. If you have a facility that had 50 people, more than at least one of them was going to have to go through some degree of quarantining and medical testing because of sharps being inappropriately handled. And so that was where there was really an area of a opportunity for the agency to further some of the programs we already had. Go ahead and go to the next slide. So the program that we maintain right now has more than 110 collection partners statewide. This historically was a derivative of the household hazardous waste program that the agency ran. But in 2015, there was a very broad opiate bill that was passed that included a directive to the agency to establish a statewide medication program. What we did is that we identified a funding source that allowed us to allocate $1 million each year from the Solid Waste Management Fund to support the program. We have a contractor who's available to pick up any materials that are collected. And effectively, we were able to open it up to any local government in the state and then some additional private partners to host these collection locations, and provided they were able to do so in compliance with DEA regulations, the agency was able to absorb all of the costs of disposal and the cost of needle disposal. Going into next year, what we're anticipating is being able to provide additional sharps collection receptacles, because one of the things that we have seen as the program has evolved is that there's a pretty broad universe of entities that are able to collect medications, but the sharps universe is a little narrower. We're proud of the work that we've done, though. In just a few short years, we've been able to divert over 2,000 tons of medications from landfills, and we've been able to continually expand our collection partners. So this is really one of the exciting things that's been going on with the agency over the past few years, and it's had a direct positive impact on the people of the state of Illinois. Go ahead and go to the next slide. So our approach, though, isn't necessarily the uniform approach. Because of a combination of the opiate epidemic and significant water concerns, many states have taken a variety of approaches on how to handle the environmental impacts of pharmaceuticals and other types of products. A model that was proposed for Illinois in a bill both last year and then for this session is one that's utilized here for other products and then nationwide for a variety of items, and that's extended producer responsibility. And effectively what that means is that the individuals who manufacture a product that has an adverse environmental impact at the end of its life bears the financial burden for finding an appropriate end-of-life home for that material, be it through appropriate recycling, repurposing, or in the case of materials that can't be recycled, appropriate disposal. In Illinois, our electronics program is operated as an EPR model, with manufacturers of TVs and other electronic devices handling those items. In a lot of cases, these have been very effectively run, and it appeared that we were headed that direction, at least until we all were sheltering in place. A second item, one that's utilized in the majority of states, are voluntary private partnerships. So basically, entities who determine through that it's part of their own corporate branding that they should collect materials. The benefit to this is that there's no public resources necessarily devoted to those type of programs. The inherent downside is that first word, it's voluntary. And so once it no longer becomes profitable, or once the public winds change, this is the type of thing that could be on the chopping block without some sort of background pushing it. One of the equally popular nationwide options for medication diversion are law enforcement funded collections. One of the reasons that this is heavily leveraged in many states is that the DEA regulations for controlled substances strongly encourage a law enforcement presence at collection sites. As a result, that's one of the most convenient ways for local governments to operate these collections. The downside is that in many other states, law enforcement budgets are tight like they are here, and this becomes yet another item that can heavily impact those budgets. And so It's beneficial because it checks a box that addresses some federal compliance issues, but at the same time, like with voluntary partnerships, sometimes those entities determine that these type of collections are lower in priority than other core obligations, and as a result, they can be cut. And the last one is the model that we use here, and it's waste management rent sharing. And so this is a landfill diversion program, and as a result, and it's currently funded in Illinois by landfill tipping fees that are provided to the agency or provided to the state based on the volume of material that is ultimately landfilled. A benefit to that is that people will unfortunately continue to produce garbage, and consequently, given that continual production, there's always a funding source. That being said, and like with some of these other models, that funding source is having to be split between numerous programs. State law characterizes the use of the Solid Waste Management Fund as a fund intended to promote recycling and other types of landfill diversion programs. And while this is a landfill diversion program, it doesn't necessarily tie into some of the broader volumetric or more holistic recycling obligations that the agency has that could really be well served by that funding. And so it's a funding model that's been successful for us, but we were very excited to explore some of the opportunities provided by the House bill that Representative Don Gershowitz had sponsored. Go ahead and go to the next slide. And so with the program that we currently run and with the common derivatives of programs like that we've seen nationwide, there are a handful of tips that we would encourage people to utilize. These are the things that we do in my own home if we have medications. The biggest one, particularly if you have small kids like me, store medications in a secure and locked area. Little kids can be like pets, and everything that is loose can be viewed as food. So this is perhaps one of the most common questions that we get asked is what to do until there's a collection event, and absolutely make sure that if you have these in your home, have them be secured. Once your material is ready for disposal, we'd encourage people to utilize the service we provide. It's free, and you can take medications in their bottles or in bags to an IEPA collection site. In addition to that, household hazardous waste collection sites across the state will accept medications, as will many law enforcement entities and retailers that have collection boxes as well. An important qualification for this is that in some cases, people are concerned about their privacy, and justifiably so because of the inherently personal nature of medication. State law does not allow an individual who is operating one of these collection sites to ask you for your personal information or to maintain that personal information. And so even though there may be an understandable degree of apprehension about participating, just be assured that your identity and the type of medications that you bring are confidential. The purpose of the program is to ensure that these materials don't fall into the wrong hands, and it's not to do some sort of holistic evaluation on who is taking what meds. Like with all programs though, we can't be everywhere at once. And so there are some instances where alternative options have to be utilized. Again, the preferred approach is for you to securely store materials at your home until you can take them to one of our collection points. But if that's not a viable option, the least desirable but workable option is to mix your medications with something from which they can't be retrieved. So coffee grounds and cat litter are the two most common ones, but there are a number of other similar items that can be utilized, and they can be disposed of with other solid waste. This is the least preferred approach, but if you're in a position where continued maintenance at your home is no longer viable, this is better than running the risk of allowing the materials to get into the wrong hands. And then absolutely don't flush them. Again, this has been a longstanding practice, and in fact, there was a point in the last decade where different state agencies took different positions on this issue, but the IEPA's perspective is do not flush these medications. Go ahead and go to the next slide. And then sharps are handled in much a similar way. Again, you're trying to minimize the amount of risk that you have to yourself. So If you have EpiPens or other sharps that you're using in your home, store them in a rigid plastic container. Take them to either one of our sponsored collection sites or to a manufacturer-supported mail-back program. Unlike for medications, there are a number of manufacturer-supported sharps mail-back programs that do exist in Illinois. And then the two don'ts: do not mix them loose sharps with waste. Again, that can run the risk of harming people who are actually providing you a service. And state law prohibits you from putting sharps that are in plastic containers in recycling bins. Again, the same thing. You're running the risk of significantly impacting somebody's life who's just going to work to help recycle materials. And it also has the effect of rendering an entire bale of plastics unrecyclable. So store your sharps in a secure, rigid container, and then take them to either one of our sites or to a manufacturer-supported site. And then we have a handful of resources on our site, and I know you're going to be bombarded with a ton of really good information. And so certainly once these are available, utilize as many of them as you can. But we have information about our program. We have some fact sheets on the medications and sharp handling for residents and businesses. And then in addition to that, we have a mapping tool on our website that allows you to put in your address, and it'll identify for you the closest participating organization in the state, at least that we sponsor. So that is all I had. I'll turn it back over to Colleen.
Thanks so much, James. I thought that was a really great overview of what's going on in Illinois. And we will be putting some of these resources into the chat box a little later. I don't think you'll be able to click on these through this. And of course, send it afterwards with the recording of this. So to get a little bit more local into one amazing program that is a great example, I'm going to turn it over to Commissioner Shore to talk about Cook County.
Well, good afternoon, everyone, and thank you, Colleen, for organizing this. Thanks for inviting me to be part of it. I'm a member of the Board of Commissioners of the Metropolitan Water Reclamation District of Greater Chicago, which is the agency that manages stormwater and treats wastewater for virtually all of Cook County, Illinois. And I've been serving on the board since late 2006. And I became interested in this issue fairly early on because of learning about emerging contaminants of concern, such as microplastics, but also pharmaceuticals in our water supply. And I learned that the treatment plants that treat our sewage are not able to remove all of the chemicals that flow into the plants when people flush unused or expired meds or pour them down the sink. And there are really three key issues that make this an important part. One is water quality, one is public health, and one is public safety. We can move on to the next image. So the reason I feel this is such a powerful image, and this picture of a fish made of pills appeared in National Geographic a decade ago when they devoted the entire April issue to water. And this image appeared across a 2-page spread about pharmaceuticals that are appearing in fish specimens. But what makes this particularly potent is that this specimen was taken from Chicago's North Shore Channel. So the different chemicals, pharmaceuticals that were found in this single specimen, this was a study conducted by Baylor University, were in our waterways, either from the treated wastewater that we can't remove all the chemicals, or from combined sewer overflows. Next slide, please. So I began to learn about what programs that were being done in other parts of the country to provide safe, secure collection for unused and expired meds, and began to work with colleagues on the Cook County Board to develop an ordinance that would establish a take-back program in Cook County. Why Cook County? Well, first, because it has home rule authority. And so the board will be able to adopt a measure applying to a highly populous urbanized county. And this might help move things nationally in the direction of product stewardship. So I mentioned water quality, but the other elements have to do with public health and public safety. We know that when people don't have a safe way to dispose of their meds, they can accumulate at home and thus become a risk to seniors who may accidentally mix things, or to teenagers or others rifling through medicine cabinets. So it's important to get them out of that drug dealer in our homes, namely the medicine cabinet. And studies have shown that perhaps as many as 50% of the people who become addicted to prescription meds start with meds they find at home. So again, this is an important measure, and it's very popular and supported among law enforcement agencies because they recognize and have to deal with many of these problems. Next image. So the Cook County Sheriff had already begun a collection program at some of the sites that they oversee, suburban courthouses in the Cook County building, because to comply with the DEA regulations at the time, there needed to be law enforcement oversight of collection sites. So it was a natural for the sheriff to provide this service as a public outreach effort. And so the Cook County ordinance was deemed to just expand on existing efforts, but to provide much more widespread collection throughout the county. And the Water Reclamation District was partnering in these efforts because I see this, and our board did, as akin to a pre-treatment program that the district has with industry. And how do we keep harmful heavy metals and other chemicals out of the waste stream? We work with those industries to have a treatment plan at their factory site. In this case, it's working with individual residents, homeowners, and others to have a way to dispose of meds before they enter the waste stream. So our agency has provided funding for this program in part over the years. Next image. It's important to remember, though, that in other places, now 6 states, but it began with county efforts in California and in Washington state to establish these drug take-back programs. They required the makers of drugs, the pharmaceutical manufacturers, to pay for the costs of collection and disposal. This is firmly seated in this product stewardship model of requiring the maker of a product like paint or tires or carpeting or electronics to pay for and be responsible for the full life cycle of that product. In the spring of 2016, an ordinance was introduced in Cook County to establish a drug take-back program, to expand the number of collection sites throughout the county, and eventually to see if we could impose a fee to recover those costs of the program from manufacturers. As it stands today, the county board has not yet acted on imposing a fee, so that currently the manufacturers pay nothing towards the costs of this collection program. Next slide. The county program has expanded to 108 sites. We'll show you a map in a minute. The Water Reclamation District contributes $100,000 a year towards the costs. And in 2018, the county reported that the costs of administering this program, Sheriff's Department employees establish collection sites, pick up the expired and unused meds, and they are transported to a safe incinerator in Indianapolis. And the cost of that program is just under $150,000 a year. Next image. In 2019, the county reported that it collected Next image, if you can. There we go. Collected 40,000 pounds of drugs. And in those maps, you'll see before the ordinance was established, there were large sections of Cook County that had hardly any safe, secure collection sites. So that's the area in white. That's what we called collection deserts. And so the opportunity to dispose of one's unused meds safely was not fairly distributed around the county. And that led many of the commissioners to realize it would be a good thing to establish a collection program and expand it. And now in the bottom map, you see how much more widespread collection sites are throughout Cook County. The ordinance mandated that there be at least 5 sites in each district. There are 17 county board districts throughout Cook County. And now in many of those districts, there are far more than 5. Next image. The Sheriff's Department weighs the meds that it collects and does an analysis of them, and found that in 2018, 25% of the meds that were disposed were prescription opioids, not heroin, but prescription opioids. So you can see how important it is to have safe disposal so that these aren't diverted, don't lead to addiction, and yet have a safe way of being collected and destroyed. Next image. Part of the program is to have a registry of pharmaceutical manufacturers whose products are sold in Cook County, but there's no requirement that manufacturers register and no fee to register. And as a result, the Sheriff's Department has not been as assertive in seeking to get the manufacturers registered here. In other parts of the country where there are statewide programs, for instance, there are between 300 and 400 registered manufacturers. I suspect there would be that many in Illinois as well if we ramp it up. But you can see the increase in the collection over the years. The ordinance was passed unanimously in October of 2016 and went into effect in January of 2017. So there have been 3 full years, as expanded markedly each year. Next image. One of the features of the Cook County Ordinance was also to establish a mailback program and provide postage paid free envelopes to residents who are homebound or disabled, can't drive to a collection site, and they can put their unused or expired pills, not fluids, but meds in this envelope, sent back to the county where, again, they're analyzed and safely disposed of. You'll see on the slide, and it'll be included at the end, the number to call if you want to request a mailback envelope. I think this is a great thing, and I'm told that Commissioner Suffredin and Sheriff Dart are going to meet to see, given the current mandate for people to stay at home, in which we may all be homebound in a manner of speaking, whether this mailback program can be significantly expanded, because quite a few of the collection sites, such as the suburban courthouses, some village halls, are now closed and people aren't able to get to them. So I hope we'll see an expansion of this program very soon. Next image. So here you have some information about how to find a site in Cook County, going to the sheriff's webpage, and my own information. Hope you avail yourself of it. Thanks for the opportunity to talk about the Cook County Ordinance.
Thank you, Commissioner Shore, and thanks for everything that you're doing on this. I'll admit it is not an issue I knew a lot about or thought we'd be paying a lot of effort to until you came with this to us and said, let's do this statewide. And I'm really glad that through this partnership, and Representative von Gershowitz's lead that we get to talk about the bill we introduced this year. So Representative, go ahead.
Good afternoon, everyone. And thank you for giving me the opportunity to talk about a bill that's really important to the state of Illinois. I am Jennifer von Gershowitz. I am the state representative for the 17th Illinois House District. And I have the privilege of being the House sponsor of House Bill 4888, which is the Illinois Drug Take Back Act. And as you mentioned, Colleen, this is an issue that really came to my attention through the work of Commissioner Shore and the members at the Illinois Environmental Council, and it has truly been a privilege to work with all of you over the last year with the goal in mind of providing a free, safe, and convenient way for everyone in our state to dispose of unwanted drugs. The Illinois Drug Take Back Act creates a statewide program for the collection, disposal, and consumer education on where drug producers and not the public bear the responsibility for costs associated with protecting public health, public safety, and our waterways. And I see you've put up the next slide, which really, I think, highlights the magnitude of the issue, the public health issue. We know that up to 71% of prescribed opioids go unused by patients. And as you can see on the screen, just to reiterate that point, the number of emergency room visits and fatalities in 2018 alone amounted to, close to 2,000 individual deaths. We know that unwanted drugs left in medicine cabinets pose both a risk to public health and public safety, and disposed of improperly, these pharmaceuticals pollute our lakes and streams and end up in our drinking water. Commissioner Shore talked about the impact of pharmaceuticals in our lakes and streams and the inability of MWRD to filter those out. And so the idea that this would end up in the water that we drink, I think highlights the need to ensure that we not only keep this out of our medicine cabinets where it is subject to being abused, but also keep it out of our waterways so that we are not ingesting this through our drinking water or through the impacts to our aquatic life. Next image, please. So for those of you out there who are unfamiliar with the terminology that was new to me up until about a year ago, but I've become very familiar with now, the concept of extended producer responsibility. Another way to think about this is product stewardship. The concept is relatively simple. It's that companies who make consumer goods bear the ultimate responsibility for managing their products at the end of the life cycle. So it shifts the cost from government and ultimately taxpayers to product producers, whereby the manufacturers who design, fund, promote, and manage their products are responsible for their safe disposal or recycling at the end of the product's life. The bottom line here is that an EPR, or a product stewardship model, is funded by the producers and not the public. This model started in Europe in the 1990s, and since then numerous countries and 6 other states in the United States have product stewardship laws to reduce pharmaceutical waste, protecting both public health and public safety. Colleen, you want to move to the next slide? So the Illinois Drug Take Back Act, House Bill 4888, applies that product stewardship model to the state of Illinois. We figure if it works in other countries, states, and counties across the US, why shouldn't Illinoisans have the same access to this kind of program to protect our public health, our safety, without our taxpayers bearing the cost? And I thought it might be worthwhile to just walk everybody through the evolution of this bill over the last year. It was first introduced last year, I think within weeks of my being sworn into the General Assembly. And it was originally House Bill 349. And sometimes when you file a bill like this, you get feedback from those who would be responsible for implementing it. And the feedback that we got was that we needed to work with our partners at the IEPA and other stakeholders to make sure that we had a model that was really implementable here in Illinois, leveraging some of the work that's already been done in Cook County, being done by the IEPA, and come up with a model that we know is going to work best here in Illinois. So we have really spent considerable time and effort over the last year meeting with stakeholders, and that work is still ongoing to ensure that we have the best bill modeled for our state to meet the ultimate goal, which is a product stewardship model where it is the producers of pharmaceutical products that ensure the safety and responsible collection and disposal of pharmaceutical waste in the state of Illinois. Next slide, please. So this is a complicated bill, and we'd be here for a lot longer than 1 o'clock if I were going to walk through all of the mechanics of this particular piece of legislation. But I wanted to just highlight some of the key aspects of this bill and why it's so important, we think, to have a statewide product stewardship model here in Illinois. This legislation would require manufacturers to be held responsible for the products that they make. Manufacturers would fund pharmaceutical take-back efforts statewide, ensuring that every resident in Illinois has convenient access to a drop-off location. And I can't stress enough how important it is and how much time we have put in and continue to put in to ensure that those who live in underserved communities have the same free, convenient access to disposing of pharmaceutical waste as those in Cook County. Manufacturers can create an independent program under this legislation or work with existing infrastructure and collectors through a reimbursement program. Again, the idea here allowing for some flexibility for manufacturers to leverage existing infrastructure and existing programs, with the key goal in mind that a certain convenience standard is hit for the consumer. This is a consumer-focused program to protect the public health and public safety of Illinoisans. This bill sets a convenience standard of 3 sites per county, plus 1 additional for every 50,000 residents. Counties with no designated collectors must still be serviced through our mail-back program or collection events. Again, here, the key is to ensure that we have a statewide program where we don't leave gaps in coverage, where we ensure that every Illinoisan can safely dispose of medications. We know that underserved communities have been particularly hard hit in some cases by the opioid epidemic. So we cannot continue to ignore the need to ensure that there is a safe and convenient way throughout our state to ensure that we collect unwanted pharmaceuticals, keep them out of our medicine cabinets and out of our waterways. Next slide. I think I touched on this a little bit, but one of the guiding principles in product stewardship models is that the ultimate responsibility for bearing the cost of a dangerous product at the end of the product life cycle is that those costs be borne by the producer. So one of the things that we're really focused on in designing this piece of legislation is ensuring that local governments, retailers, and law enforcement don't bear the full cost of these programs. I think James Jennings from IEPA and Commissioner Shore outlined really the core issue that we have with some of the programs in existence now, which is that the burden for funding these programs either falls on the taxpayer, or in the case of IEPA, might not be a sustainable source of funding for a statewide program indefinitely going forward. This is a model with a sustainable source of funding that we can ensure will provide coverage for our entire state on an ongoing basis consistently. Next slide. And then, of course, none of these programs can accomplish and achieve our ultimate goal of ensuring that all of our unwanted medications are safely disposed of and collected responsibly without educating the public. If the public doesn't know what they're supposed to do with unwanted drugs, they can't dispose of them properly and keep them out of their medicine cabinets. So a big part of this bill is also focused on education and outreach. We need to partner with stakeholders to ensure that the public understands where they can dispose of unwanted and unused pharmaceutical waste, and ensure that they understand what is available in their area. I know that in Cook County, we have opportunities to recycle some of our pharmaceuticals, but I'll admit that prior to doing my research in connection with this bill, I couldn't have told you what the safe, responsible way to dispose of unwanted medications left in our medicine cabinets might be, and we all know that we have them. So this idea that the consumer is responsible for figuring this out, I think is a little bit outdated. I think that we need to do more to ensure that the consumer knows where they can recycle and dispose of these medications. And House Bill 4888 includes education and outreach as part of the goals for this bill. And before moving on to question and answers, I feel like I'd be remiss if I didn't talk a little bit about where we are. I think, as most of you out there probably know, the pandemic has impacted our work in the General Assembly. And we are at this moment firing on all cylinders to deal with the immediate needs of this pandemic. That means that, at least in the short term, our work on this bill has been put somewhat on hold. And I cannot wait, honestly, until we have the opportunity to be able to be back in Springfield together, fighting the good fight and working on protecting our environment together. And this bill is going to remain one of my top priorities. So it's not going to disappear. It's just put a little bit on hold, like a lot of things in our lives these days. But I can promise you that we will get back to it.
Thank you so much, Representative Gong-Dershowitz. And I know we really wanted to have this conversation today, to talk about this issue because, well, it may be something many in the environmental community are aware of. I think the full scope of exactly what's been discussed, it being a public health, a public safety, and a environmental crisis, isn't necessarily known. And one thing that I especially want to touch on is this idea around cost, because we hear it all the time, IEC hears it all the time on any bill we want to do, that, industry and pharma, they don't want to pay for things. And they don't want to take full responsibility. And that's why EPR is so important. But the costs right now, Commissioner Shore laid out how much this is costing Cook County and MWRD. James went through how much the state of Illinois is putting into these efforts. Taxpayers are paying right now, not only for these programs, but also for the very real implications of not doing anything, whether it's additional costs that MWRD and other wastewater treatment facilities throughout our state have to incur to try and get these out of our water and our waste stream, or if it's the cost of the opioid crisis. So it's definitely not a balanced scale. And right now, we don't see drug companies paying into this to the extent that they really need to. And we're also not seeing the oversight that we need and the education, as Representative Gon-Gershowitz just laid out too. So getting into the Q&A, I see we have a lot of good questions in the chat, so thank you. There was one question just to start that it looks like got addressed, but for those on the phone, there was a question about what happens to the drugs and the sharps that are diverted and don't go into our landfill. And we have, looks like someone from the National Stewardship Action Council, another great partner on, who answered that yes, meds are often incinerated and sharps can be shredded. And I don't know, James, if there's anything you want to add there as far as EPA's processes about what happens to these diverted materials.
No, so both of those are directly in line with how our handling contracts are set up. The only thing I would add to that is that there are a growing number of other states that are utilizing their diversion program as a way to help provide unused medications to individuals who may need them, almost like a kind of like a secondhand type of pharmacy for people who meet certain economic requirements. Illinois law doesn't currently allow for that, but several other Midwestern states are going that route. And so that's something you could conceivably see in the next decade or so because of the number of other jurisdictions that are going that route. But yeah, right now, incineration and shredding are the two primary handling options.
Thanks. And actually, another logistical point for people who are on the Zoom, you can hit the speaker view instead of the gallery view if you don't want to play the Brady Bunch here with all of our environmental friends. But the second question got addressed that I think Commissioner Shores is for you is to how are POTWs monitoring and testing for pharmaceuticals? I don't think it's exactly that simple, right? That it's each pharmaceutical or each compound. So could you speak a little bit about how MWRD is going forward with that?
Sure, thank you, Colleen. So the Water Reclamation District does not routinely test for pharmaceuticals, but we have periodically provided samples to labs, and we know that pharmaceuticals certainly are coming into the waste stream, mostly through what our bodies don't absorb and we excrete into wastewater, but also through what people flush down the toilet and pour down the sink. And of course, anything that's pills that are flushed or fluids that are poured down the sink are full strength as opposed to what we excrete. But we also measure at times what leaves our treatment plants in the treated wastewater. And so we are well aware that we cannot remove all of those chemicals. And the volumes of wastewater that we treat in Cook County are so large, generally 1.5 billion gallons a day, and sometimes far more than that. We could technologically remove those chemicals, but the cost would be astronomical to do so.
Thanks, Commissioner. There have been a series of other questions, so I'll try and get to them in order here. I think there's a lot of interest in outside of government-run programs. Commissioner Shore highlighted what's happening in Cook County, and James mentioned that on EPA's website you can go and see what's happening statewide. IEC works with partners like the Solid Waste Agency of Lake County, as well as Will County, that are running really robust programs. But maybe, James, you could speak to some of what I think people see in the public of maybe partnerships between certain retailers and large pharma, and then also some questions about maybe what are hospitals currently doing and what the practice could be there.
Yeah, so even in how you framed this, sort of underscored that statewide, this is sort of a fractured program with numerous different entities operating kind of in their own orbit. Many of the kind of big box retailers that have pharmacies on site do provide some degree of med collection. And the same goes for hospitals that also have pharmacies on site. What you end up encountering with those, though, is a varying degree of what is and is not acceptable. So some will take controlled substances, some will not. In some instances, the medication drop box is not necessarily evident. There was a point where DEA had all of the registered controlled substances sites on their website, and you could map it out just like on our website. Unfortunately, just because you could map it didn't mean that once you actually got to that campus, you'd have any idea where you were going or what was there. So the areas of the state where we've got deserts are really, as you'd expect, rural areas that may not have a significant retailer presence, or where their local government just hasn't had the bandwidth to be able to participate in our program. So I think that covers what you were looking for.
Yeah, no, I think that's helpful. And of course, was sort of mentioned in the coalition that we formed in House Bill 4888, and Representative von Gershowitz, feel free to jump in here. But the retailers, especially our small mom and pop stores, as well as CVS, Walgreens, et cetera, are partners in this work as well, because people are going into those already, right, to get their drugs. And so it's really important to have safe and accessible drop-off locations there as well. And right now, those retailers are paying for this on themselves by and large as well. So of course, another example of pharmaceutical companies not pitching in. I don't know, Jen, if there's anything you want to add there.
Yeah, no, I would just piggyback off of your comment with respect to cost and just consistency. I think the more that you have a patchwork, the more it creates confusion with consumers. If our collection sites aren't universally monitored and maintained, and if information is not consistent statewide, you have confusion, I think, understandably so, among the public about where and how to dispose of these medications, and ultimately whose responsibility it is to pay for the collection and disposal. I think one of the things that we are going to be confronting for a long time after the pandemic are limited resources in our state budgets, our county budgets, and our municipal budgets. That doesn't mean that these efforts become less important, but it becomes more important that we have a source of funding and a product stewardship model that places the responsibility for the end of life cycle of products that are dangerous if left in medicine cabinets or disposed of improperly, where the responsibility should lie and is determined to have lied in many other states and countries throughout the world. So we need a partner here, and that partner, I think, should include the drug manufacturers. And I think that we have a good dialogue going, and I think a real opportunity here to develop a bill that accomplishes the goals that we've set out.
Thanks. And yeah, I feel like that's kind of a common thread in some of the questions I'm seeing too, is, what is our conversation with pharmaceutical companies on this? And had we still been in Springfield throughout March and April, we would have continued those conversations. But I think the other thing that's coming up as a thread here is the lack of consistency. In the south suburbs, they're not accepting liquid, or at my retail facility, they're not accepting sharps, or this county only accepts one versus the other, and we're going to continue to see a really patchwork approach, as James referenced, if we don't have this kind of statewide understanding. And until we have that, we won't have those education efforts, we won't have the mail back and collection events that are needed to address equity issues for access to safe disposal in rural places, and we're going to see bad practices. So Commissioner Shore, it's been stated, but the most common thing people do, unfortunately, outside of abuse of these, is flush them down the toilet. So I wonder if you could just, again, state how damaging that really is, of course, for aquatic life and the environment, but for our wastewater treatment facilities.
Thank you, Colleen, for the chance to reinforce a current message from most wastewater plants, and that is that toilets are not trash cans. And let me amplify. There are only 3 things that ought to be flushed: poop, pee, and toilet paper. And here's why. Because with the pandemic and the mandates for us to stay at home, many local utilities and homeowners are experiencing clogged pipes, and that can lead to sewage backups, which is a public health issue, because people are flushing paper towels, Kleenex, wipes that are not truly flushable. I mean, they can flush, but they don't dissolve. So all those products, disinfecting wipes, wet wipes, paper towels, Kleenex, use them, but throw them out in the trash. And to take issue with Jim just a bit in terms of rural areas where there may not be collection sites, and the recommendation is to mix unused drugs with kitty litter or coffee grounds. Things thrown out in the trash end up in landfill. And landfill leachate, in other words, the liquids that flow out of a landfill come into our sewage system. So those drugs that are disposed of in the trash will still end up in the leachate coming into a sewage plant where we can't remove all of those pharmaceuticals. So it's really important to dispose of them in a way that they'll be collected and destroyed. So in rural areas, that's what I'd like to see, is a really widespread and robust mail-back program where people can safely dispose of their meds and not put them in the trash. So remember, toilets are not trash cans. Thank you.
That was a good PSA, but especially important now because I have seen a lot of conversation on social media, if nothing else, about flushable wipes, which are not flushable. But to stay on topic a little bit and close us out here, I think we've talked a lot about consistency, but how there are programs that local governments and law enforcement are operating. And there was just a question of, is there a website where someone can go? James, I don't know how comprehensive IEPA's is. Maybe you could answer that, or just for all of our expert panelists to give a closeout here. Where should people go right now if they're trying to get information about how to safely dispose of these pharmaceuticals?
Yes, I'm happy to start. So our website lists every entity that is one of our partners, as well as many of the law enforcement organizations in Cook County that had requested to be posted on our website. So that's certainly a good starting point from a statewide perspective. It may be a little more limited than potentially resources that are available to NWRD, but that's going to be at least a good starting point. And yeah, the only other thing is I would echo what Commissioner Shore said. I 100% agree. People need to utilize these resources. This is right now the primary and really only safe way to dispose of these materials. And the more commonplace that this behavior becomes, the more it's going to become ingrained in our overall social DNA, and it'll continue to spread. So definitely use our resources, but even more importantly, utilize these services, because that's one of the key ingredients to their continued operation.
Thanks, James. Commissioner Shore, Representative, do you want to give a final pitch or comment here?
I'll just jump in to say that it has never been more evident how much each of our health and safety depends on one another. And I cannot thank you, all of you, for tuning in, for staying safe, for staying indoors. I know we all miss being out there on the front lines, working together, but we'll be there soon. And I have no doubt with the same and passion that we've continued to work together over the last year. So stay safe, everyone. And I look forward to seeing you in person, hopefully sooner rather than later.
And thank you, Colleen, for hosting this. Thank you, Representative Gon-Gershowitz, for your leadership, and Mr. Jennings for your involvement and active participation. I look forward to Illinois achieving a sound, progressive bill that's developed collaboratively with manufacturers, with retailers, with public health and public safety and environmental advocates. I think Illinois can be a leader in this effort, and I look forward to helping. Thanks so much.
Thank you all. Thank you guys for joining in. Continue to support IEC, learn more about the work that we're doing on this and so many other issues on our website. And I think Paloma dropped in some information on the chat. Stay healthy, be well, and enjoy the rest of your day. Thanks all.